Government confirms first case of Ebola in U.S. The unidentified man was critically ill and has been in isolation at Texas Health Presbyterian Hospital since Sunday, federal health officials said. They would not reveal his nationality or age. Authorities have begun tracking down family, friends and anyone else who may have come in close contact with him and could be at risk for becoming ill. But officials said there are no other suspected cases in Texas. At the Centers for Disease Control and Prevention, Director Tom Frieden said the man left Liberia on September 19, arrived the next day to visit relatives and started feeling ill 4 or 5 days later. He said it was not clear how the patient became infected. There was no risk to any fellow airline passengers because the man had no symptoms when he was traveling, Frieden said. Ebola symptoms can include fever, muscle pain, vomiting and bleeding, and can appear as long as 21 days after exposure to the virus. The disease is not contagious until symptoms begin, and it takes close contact with bodily fluids to spread. The bottom line here is that I have no doubt we will control this importation, or this case of Ebola, so that it does not spread widely in this country, Frieden told reporters. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks, he added. But there is no doubt in my mind that we will stop it here. President Barack Obama was briefed about the diagnosis in a call from Frieden, the White House said. Word of the infection alarmed the local Liberian community. People have been calling, trying to find out if anybody knows the family, said Stanley Gay, president of the Liberian Community Association of Dallas-Fort Worth. We've been telling people to try to stay away from social gatherings. 4 American aid workers who became infected in West Africa have been flown back to the U.S. for treatment after they became sick. They were cared for in special isolation facilities at hospitals in Atlanta and Nebraska. 3 have recovered. Also, a U.S. doctor exposed to the virus in Sierra Leone is under observation in a similar facility at the National Institutes of Health. The U.S. has only 4 such isolation units. Asked whether the Texas patient would be moved to one of those specialty facilities, Frieden said there was no need and virtually any hospital can provide the proper care and infection control. Dr. Edward Goodman, an epidemiologist at the hospital, said the U.S. was much better prepared to handle the disease than African hospitals, which are often short of doctors, gloves, gowns and masks. We don't have those problems. So we are perfectly capable of taking care of this patient with no risk to other people, Goodman said. After arriving in the U.S. on September 20, the man began to develop symptoms last Wednesday and initially sought care 2 days later. But he was released. At the time, hospital officials did not know he had been in West Africa. He returned later as his condition worsened. Blood tests by Texas health officials and a CDC separately confirmed an Ebola diagnosis on Tuesday.